We continue our investigation into the closing of Waterview Heights Nursing and Rehabilitation Center. As we told you yesterday, the Department of Health has approved a plan to move more than 160 Waterview residents to new homes. Deanna Dewberry has been leading our coverage of this facility. And Deanna, this is no small feat.
No, Nikki, it certainly is not a small feat. As we've reported, Waterview is being forced to close because inspectors say conditions there are so bad they put residents at risk. And as we face a major shortage of nursing home beds, Waterview had to come up with a plan to move everyone to another nursing home. Tonight, details of that plan.
When the nonprofit Family Service of Rochester went belly up last summer, forcing residents at 4 assisted living facilities to move out, few expressed the frustration felt by displaced seniors as clearly as 80-year-old Georgia Jackson.
This country is supposed to be the land of the free and the home of the brave, but in other countries, they take care of their elders.
Fortunately, Miss Georgia was among the fortunate to finally find a Rochester assisted living facility to call home. That was not the case for everyone. Many sobbed with the knowledge they were being sent hours away. Will that be the plight of the now displaced residents of Waterview Heights? According to Waterview's closure plan, approved by the Department of Health, the goal is to keep residents here, close to family and friends.
The first phase is to look for homes in a 10-mile radius, which would keep everybody, of course, in our community. If that's not possible, a 25-mile radius, once again, still very close to our community.
Anne Marie Cook, CEO of Lifespan, says Waterview must provide a copy to the organization so it can support residents during the transition. Family members who reached out to me are frantic. One wrote me saying Waterview staff told them, "You can choose from these other facilities. If you refuse these, your family member will be sent to Pennsylvania."
Pennsylvania is not in the plan, and we're once again just really advocating that every resident stays in our community.
The plan promises that every resident will be assessed, assuring the facility meets their needs, and residents' preferences will be given priority. The goal? Find new nursing homes for everyone by September 24th.
I'm concerned, but we're hoping that if every home takes some residents, those people will get rehoused in the Rochester community.
But it is very unlikely that every home will take some of the Waterview residents. Nursing home leaders say the Medicaid reimbursement rate doesn't cover the cost to care for the residents they already have. So nursing home space is very limited. Listen to what a senior vice president of the Jewish home had to say.
If we had beds available and they qualified, absolutely we would look at their application. But right now we have waiting lists already due to that shortage.
So I've talked to another nursing home administrator who says he can take a few, but will the Department of Health be able to find beds within a 25-mile radius for more than 160 people? So, Nikki, I really can't answer that question. I don't know if any of us can right now, but of course, I'll keep investigating and following it very closely.
All right, thank you, Dee. And Deanna has done a number of stories with information on how to research a quality nursing home. If you're doing this, you really need to check these out. We have links in this story as well as the others on our website.